A few members of an underground gang have been arrested for crimes against Fluffy the dog. Here are comments from a healthy dog Luna and her Demodex good Dex on their opinion.
It is unfortunate that they were once good citizens of Fluffy's hair follicles and sebaceous glands.
We Demodex canis could never survive out there in the environment or on other species. Our great dog host Luna and her immune system is kind enough to tolerate us for our entire lives. They stop us from overpopulating Luna, but in exchange, they don't attack us. Sounds like a good deal to me. I remember my first time migrating here from Luna's mother. We had 72 hours to migrate after Luna was first born and was suckling. Such prolonged skin-to-skin contact only comes once in a blue moon. Time passed by so fast. My grandkids are now in different stages of their life cycle. This is Egberry, Larry John, nymph Eva Max, and my adult daughter Grace.
Now joining us is Dr. Liza Good to tell us about demodicosis.
We can classify demodicosis based on the number of body regions involved, which usually also translates to how bad the disease is. In the generalized form, the age of onset is important. Dogs with juvenile onset demodicosis generally have an autosomal recessive inherited T lymphocyte dysfunction. The good news is that as they get older, their immune system matures and eventually will be able to control the Demodex. On the other hand, dogs with adult onset demodicosis usually have an acquired immune compromise from diseases or medications.
Just in, CCTV footage of the ongoing war shows T-cell exhaustion resulting in progressive loss in T-cell functions, supportive cytokines diminishing while suppressive cytokines increasing. We can expect low numbers of CD4 lymphocytes. Scientists have also recovered the gang's master plans, from alopecia to papules and pustules to secondary bacterial infections. That's just a sneak peek into their horrific crimes. On a better note, we have Officer Mighty to tell us effective ways to diagnose demodicosis.
The best tool we use to find and arrest Demodex is skin scraping. For victims who are scared of pain, we can use acetate tape impression or a trichogram instead, but these are not as great as scraping. There are other methods that we rarely use. For example, exudate microscopy can be useful for more severe forms of demodicosis with purulent exudates.
Hey, but how do you know that I'm bad?
Right. Although they're part of normal flora, they're usually difficult to find, so finding one generally means high likelihood of demodicosis, but at the same time, it is not definitive, so we might try to look for more. Finding multiple in dogs with obvious clinical signs can give us a definitive diagnosis.
Ouch! Even the diagnosis methods don't sound pleasant, but do not panic. With efforts from the research team, we found a myriad of solutions that will hopefully eliminate demodicosis.
Here are spot-on topical treatments for demodicosis. Oral drugs can be helpful for more aggressive generalized demodicosis, and we recommend Reflecto. There are also injectable therapies and dipping. A special shampoo can also be helpful, especially for those who cannot take drugs, such as puppies under 4 months old. For dogs with secondary bacterial infections, we will also use special shampoos and antibiotics to treat the infections.
Doggy couples with generalized demodicosis should prevent having pups as it is heritable.
To learn more about demodicosis, dial 02 Demodex. And as they always say, a strong immune system every day keeps most of the Demodex away. Bye for now.